305 Fights, where the champions rise. 305, donde surgen los campeones. We have a great special podcast today at 305 Fights, Sports, Combat, and Entertainment. We have Dr. Jimenez from Chiropractic Med Spa. Dr. Jimenez, thank you so much. Welcome to the podcast.
Thank you. Thank you so much, Elio.
I'm so glad that we that league and entertainment 305 Fights. We have MMA, kickboxing, Muay Thai, grappling. We also have a martial arts school. And in the martial arts and in combat sports, we want to promote a healthy lifestyle, a healthy mind, spirit, and body. And you're in the same field, providing a healthy mind, spirit, and body for people. So thank you very much.
Thank you. Thank you for inviting me again.
Okay, let's start. I would like to maybe speak a little bit about Jimenez Chiropractic Med Spa, about your facility. Can you speak a little bit about your facility, please?
Yes. So my facility is here in Miami, and it's a multidisciplinary practice. I'm a sports chiropractor. In the office, we have services such as acupuncture, massage. We have a medical doctor on staff. So we're able to treat many different injuries, many different conditions. So we're definitely fully licensed and well-versed in many sports injuries.
Okay, so your facility, Jimenez Chiropractic Med Spa, is located in Coral Gables. Your social media and Instagram is?
Jimenez Chiro Med.
Okay, Jimenez Chiro Med. Excellent. Your website is jimenezchiromed.com, correct?
That is correct.
And you're also on Facebook as Jimenez Chiropractic Med Spa.
That's correct.
Awesome. So anybody wants to get a hold of you for any questions or information, feel free to contact. If not, you can contact us at 305fights.tv and we'll get you the information. Like you said, you guys have a variety of chiropractic, nutritional, rejuvenation services, wellness services.
That's correct.
All type of therapies, and we'll get into the therapies. Before we do that, I wanted to talk a little bit about a little bio on yourself, Dr. Jimenez. Can you give us a little bio on yourself, please?
Yes, so I have a bachelor's in biomedical science from the University of South Florida. I also graduated from Palmer College of Chiropractic. I'm a doctor of chiropractic. I also have additional training in sports medicine. I'm a certified chiropractic sports physician. So I have a lot of years behind me. So I graduated in 2011. So I've been practicing for about 9 years. I see anywhere from general back pain, neck pain injuries to traumatic injuries such as sports injuries, dislocations, tears, ligamentous or tendon tears, shoulder, knee, ankle, etc. So definitely.
Excellent. And you're certified in chiropractic sports physician, correct?
That is correct.
Yes, and we'll be talking about today. In fact, you provide services for us which are very professional, very pleasant, very safe atmosphere, and you have a lot of background in the sports medicine. I see you had with Escape Miami Triathlon, U.S. Pro Beach Volleyball, and different associations and therapies, correct?
That is correct.
Let's get to some of the modalities because, like I said, these modalities nowadays in combat sports and martial arts, for example, like ourselves, no longer do our people go into these modalities just because they feel sick or they're unhealthy, but it's part of their lifestyle. If you're doing martial arts, if you're doing any physical activity, it's actually part of the physical activity. A lot of the combat athletes, it's part of their physical activity. For example, let's go into one of the therapies you guys provide is the massage or the body work, correct?
That's correct.
And nowadays, for myself, for example, in our gym, and one of my background, a lot of my teachers are traditional Chinese medicine doctors and are doctors. And the body work and the massage is not just, like you said, when you feel stiff muscle, but it's actually part of their training. It's part of their lifestyle. I have a twin brother who has a martial arts school, Twin Dragons Martial Arts, and he's at his age now competing. And one of the things he uses to release the lactic acid in his body is the physical therapy and the massage. Can you tell us a little bit about how the body work and the massage is physical therapy good for you?
Yeah, so obviously we want to promote health. We want to promote well-being. So this is not something just that you do when you're injured. When you're injured, you have to recover from the injury. So the treatments are very different. When you're well and you're training, for example, if you're training for a big fight, you want to come in regularly just to keep everything loose. A weekly adjustment or every 2 weeks at the very least come in and get a full spine adjustment. Keep your spine moving correctly. If your joints are moving correctly, there's going to be less stress on your muscles, on your tendons, and your ligaments. So less chance of getting injured. The massage and the physical therapy modalities go hand in hand with that. So every time you come in my office particularly, you get not only do you get adjusted, but you also get a massage. You also get some physical therapy, kind of loosen up those tight muscles, those trigger points, those knots, kind of keep everything loose and moving correctly so that you prevent an injury that way.
Correct. For example, myself as an example, going over there to your facility and being treated by yourself. First, I go as a person that's promoting a healthy lifestyle as a citizen. Second, as a martial arts instructor, a coach of athletes, and being involved in the martial arts, I get an adjustment, a chiropractic adjustment to make sure my alignment, but at the same time, I get body work and massage therapy. On a given day, I might get also some physical therapy. And that's, again, it's not just to participate in the martial arts, but to also maintain a healthy lifestyle, even when you're not practicing martial arts or even if you're not competing in the martial arts.
That's correct.
For example, how these modalities have become mainstream now in combat sports. One of our teachers, traditional Chinese martial arts teacher, George Shu, and his brother Gordon Shu, they do a lot of acupuncture, massage, and they also do cupping, which I realized you did cupping over there, and a lot of the athletes are doing the cupping. Can you explain a little bit about the cupping therapy for the athletes and for citizens?
Yeah, definitely. So the cupping is one of the traditional Chinese modalities that's becoming more mainstream now. A lot of the Olympic high level athletes are using them. So it's become very popular in the past couple of years. We do a couple different cuppings in the office. I use cupping myself as more of a myofascial release technique. So the cupping, what it does, it increases the blood flow to the muscles wherever we apply the cups and kind of move it around. So to kind of loosen up that fascia. The fascia is the tissue that covers all the muscles in the body. So whenever you have fascial restrictions and you have decreased blood flow in that area, you're more likely to injure that muscle performing your sport. So if we use the cupping for fascial release to kind of increase blood flow, add that to a massage, you'll get a much better effect.
Yes, correct. And like I said, I see a lot in a lot of the academies, a lot of the facilities. This like I said, this has become part of the training. Actually, in the class, as part of your stretching, it's no longer just regular stretching, but you, like you said, myofascial release, maybe with a foam roller or other types. You also have vitamin therapy and nutrition supplements. That's another one of the modalities I take advantage when I go over there is the vitamin therapy and the nutrition. Can you speak a little bit about that, please?
Yeah, so we provide, we have anywhere from just weekly injections. We do vitamin B12, B complex, amino acids. We also have vitamin C available. We do have a couple patients that come in, they're constantly training, so they'll come in once a month and do an IV therapy. The difference is when you do any type of nutrition IV, you absorb 100% of it. So all the nutrients go directly into your bloodstream. So you get a much better effect. Whereas when you do an injection, you're limited to the amount that the muscle can absorb at that site. So you're getting anywhere between 10 to 20% of the nutrients. So the IV therapy in the office, we highly recommend it, especially if you're competing in high level sports, because you do absorb 100% of the nutrients, and the more nutrients you have, the more energy and the better you can perform.
Correct. And what I found is that, like I said, in training and daily life, the nutrients and the supplements are very important because sometimes during the day we don't have, because of the foods or our lifestyle, an opportunity to get all these valuable nutrients and micronutrients. And we could get some supplements before the training, after the training. I was looking at an article actually, the type of foods you should eat after training and recovery. What is your feelings on that?
I mean, definitely you want to be well hydrated. So any type of antioxidants that you take on a regular basis is good for you. So antioxidants, all the vitamin B12, B complex, B1, 2, and 3, B6 is important. Vitamin C is a very high level antioxidant and it's good for your immune system, especially now with virus. It's very important to maintain a healthy immune system. Especially after a fight, you do want to have more of a recovery. So any type of hydration with these vitamins and micronutrients are going to be good for your muscles, kind of rehydrate, recover from everything all the training you've done.
Yeah, that's a good point. A lot of the fighters and a lot of the athletes, they have to make a certain weight. So after they weigh in, they're most of the time dehydrated because maybe they don't lose the weight properly or to make the weight. And that's something that most people don't realize, that even when they go train, you might think you're hydrated, but you could also always be more hydrated. And like you said, maybe take some amino acids before or after. I just found that supplementation and nutrition and the vitamin therapy that I'm receiving over there has been very, very good. And actually, last time we were talking about vitamin D.
Right. Well, vitamin D is actually a really good vitamin that people overlook. It's a fat soluble vitamin, so it's different from your vitamin B and your vitamin C. Fat soluble means that in order to absorb it, you have to combine it with some kind of fat. So you have to take it with food orally to be able to absorb it. So vitamin D, normally your body produces its own vitamin C from sun exposure. A lot of us don't get a lot of sun. So we're mainly indoors training in the gym or not going for runs outdoors anymore as much. So we don't produce as much vitamin D as we should. And vitamin D is very, very important for hormone production, to maintain good bone health, good joint health. And they're actually discovering more and more things about these vitamin D. So it plays a good role in your immune system. They're finding out studies now with the COVID-19 virus that low level vitamin D actually it can put you at risk. So it's a very important vitamin that people don't really think about too much.
Correct. Okay, let's get into the health sciences of the martial arts and combat sports and all the different modalities offered. Not in sports at your facility and really in general that should be practiced. One of them is the chiropractic and the adjustment and the structure. For us in our program is very important. Again, I refer back to the Chinese martial arts. One of my masters, Master Lasher Fang, he is what in China would be called a bone setter. And a bone setter is an old Chinese term for basically a chiropractor. And he was explaining about the structure and work a lot on having a proper structure. Like when I come in, you check the level of my feet, that everything is symmetrical. Can you talk to me about chiropractic and the structure and whatnot in the practice, please?
Yes, definitely. So it's a very good relation between structure and function. So for your body to perform correctly, your joints need to be aligned correctly and moving correctly. So the first thing I do with an analysis, obviously I already know you, so I already kind of have an idea of your conditions. But generally, when a patient, I evaluate them fully. I treat their condition, their main concern for coming in. Once they're into their treatment plan, part of the adjustments is to do the leg length check. So when you're laying down on your stomach, I will check the bottom of your feet, make sure that your legs are equally or symmetric. If they're not, that can indicate that you have maybe a pelvic tilt or a pelvic dysfunction that is can lead to an injury in the lower back or the lower extremities. So I will make sure that your legs are symmetric. If they're not, I will adjust the pelvis accordingly, and then your spine according to that. And that's very important because that can lead to knee injuries, hip injuries, and lower back injuries, especially.
Yes, I agree 100%. And in the health and fitness part of the martial arts and combat sports, for us, like our system, our martial arts system is called natural motion system. And you said something interesting. Structure has to do with function and mobility. So and the how they work together. So we work a lot on that structure, and with certain stretching for structure, like let's say like yoga is very good to keep the structure. One of the treatment methods that you use over there is a spinal manipulation, a manipulation, the joint manual joint manipulation, flexor distraction manipulation, and low force manipulation. Can you talk to us a little bit about that spinal manipulation, please?
Yes. So spinal manipulation, the main one that I use is more of a manual manipulation. So I will manually adjust your spine and your joints. And when I talk about the spine, yeah, the spine is very important, but we look at everything. We look at your hip, your pelvis, your knees, ankles, your wrists, elbows, everything. So we adjust every joint in the body if needed. In addition to that, we have the flex distraction, as you mentioned. That's more of a lower force technique. I use a specialized table that will kind of flex and kind of distract, kind of open up the joints in the spine. So people that have disc injuries or they have herniations or disc bulges, this technique is very good for that because it will allow for that motion and hydration of the disc properly. So that's one of the examples of the low force technique that I use.
Yeah, a very good point that you said. We're talking about the spine and chiropractic, but we're also talking about the joints. You know, if you notice, what I notice a lot with a lot of the students, a lot of the athletes is there's a lot of shoulder joint problems and hip joint problems and knee joint problems. And if you go to a normal gym, like a LA Fitness weight gym, they have a lot of machines for your muscles, but you don't really see a joint machine. So the joints have to be maintenance, they have to be taken care of and adjusted and whatnot. And what do you use to keep that joint health?
Right. So in addition to the joint manipulation, that's kind of like the first step. So we kind of realign the joint, make sure that it's moving good. Then I'll start working on your muscles. And some of the other techniques I can employ would be Graston technique, which is I have specialized tools that we'll use kind of like scrape your skin kind of feels, but I'm more working on the fascia. So I will kind of loosen up that fascia. If I notice that you have, for example, you mentioned the shoulders. A lot of people have that rounded shoulders, so they have the bad posture, so the pecs are tight and their shoulders are kind of rounded forward. That creates a shoulder dysfunction that has weakness in the back muscles, in the traps and the rhomboids. So what I'll work is loosen up the pecs using that Graston technique. I can also use shock wave, which is a special sound wave technique that can just kind of break up those scar tissue and then start working on strengthening the back muscles to kind of bring your shoulders back and keeping that posture upright. Like I said, the massage, the chiropractic adjustments, the Graston, the shock wave, all those techniques work together to achieve the ultimate goal, basically.
Yeah, you mentioned something there that I noticed on your Facebook that we're going to get to that I really liked, is you worked two modalities together, and you were working on a gentleman that does judo.
Yes. Yes.
I wanted to highlight that you talked about how the body's connected. For example, when I first went to see, I had knee surgery, and I went to see the knee doctor, and I had a little bit of pain in my knees. And he checked my back for a second, and he said, "No, it's not your knees, it's your back." And that's how I went to your facility, and we started working on the back. And I realized that once we started working on the back issues, the knee issues went away. So the body is interconnected. And so you have to treat it like a holistic system. What did you say?
Definitely. Your fascia connects every muscle in the body. So you can start by having a lower back injury and develop shoulder problems because of that, and vice versa. So it's important to take a step back. Once you get out of that initial phase of acute pain, you take a step back and say, okay, what is the real cause of the problem here? Why did you have this injury? And then analyze the whole body and using biomechanics, and then work on a way to achieve more of a perfect form so that you don't re-injure the same site.
Excellent. Let's go further into the sports medicines and different modalities that are offered. And you have here also management of, we want to talk about this topic, management of concussion, especially for combat sports. I'm always talking up to training the fighters and martial artists about when you're sparring and you're having contact, I don't believe in full contact because I don't believe in getting concussions to get in a cage in a ring to get another concussion. And can talk to me a little bit about management, concussion management, please?
Yes, it's very important. So especially with combat sports, if you do suffer a concussion, it's very important to get the proper treatment because repeated concussions can lead to a very serious injury to your brain. A concussion is a mild traumatic force to your brain. So, concussions can vary from just being dazed or disoriented to having sensitivity to light or sound, to even having episodes of losing consciousness. So it's very important if you do have a head impact to get properly evaluated after the fight or after the sport to make sure you don't have a concussion. And if you do, to have that progressive follow-ups, either with me or any trained individual. I manage concussions very conservatively, but if needed, I also consult with local neurologists whenever needed.
Yes, we were training once in the school, and we were actually doing throws, and the student fell, suspended, judo mat, whatnot. He didn't hit his head. His head just went like this, and we finished. We went to a tournament. We were in a tournament. He started feeling sick, dizzy, started throwing up. Mm-hmm. I immediately said, "Hey, let's go to the emergency room. Let's check for a concussion." And guess what? It was a concussion. So you have to watch that. You have to train good, but train smart. And that's why we have the safety equipment, and that's why you should have a protocol and you should have a methodology in training. Let's talk a little bit about the athletes and chronic and acute injuries. For example, what I noticed with myself is that if you don't take care of these injuries when they're minor, they can become bigger problems later on. So what would your advice on athletes training the chronic and acute injuries?
Yes, perfect. So definitely acute injuries differ from chronic injuries. So an acute injury, you're going to have sharp pain, you're going to have inflammation, you're going to have more of an acute response that's talking about maybe like a tear or like a recent tear or could be a dislocation, for example. A chronic injury would be maybe a repeated stress to that joint or muscle. So you can have minor injuries that over time become a chronic problem. So it could be like an ankle sprain, for example. You just twist your ankle one day, you're fine, okay. Then it happens again, then it happens a third time, then it happens a fourth time. Eventually, that ligament gets so overstretched that when you do it in combat, you can dislocate it or tear it completely, and then it becomes a surgical procedure. If you treat it the first time, when you just injured it the first time, when you just twisted it, then you're treating a mild sprain. You can treat it correctly, strengthen, and stabilize that joint so you don't have those repeated stresses.
Yes, that's why we promote a lot of what we call smart training, because I've done both phases. I'm from the old school where you used to just train until you destroyed your body, and that would help you somehow. And then now I'm paying for it, and I research the other modalities. I think it has to be a blend of the old school with the new school. We always say essence, evolution, and innovation in your training, which takes me to a topic here that you have. One of the also things that you prescribe is the exercise prescription. Can you explain to me when you have this title here, exercise prescription?
Yes. So, I'll give you an example. I had a couple years ago, I had a young athlete. She's a wrestler, very high level combat. completely destroying herself. She's in her 20s. That's what you do. Anyway, so she came in and she dislocated her elbow, and she came crying because she went to the ER, and the ER said, okay, well, you know what, kiss your wrestling career goodbye, let's do surgery. And she's like completely distraught. And I basically said, okay, well, let's take a step back, let's look at this. Fast forward 6 months, she's 100% recovered, no surgery needed. Obviously, she's being careful, and wearing her braces and things like that. But those are the type of things that you want to see. Had she gotten the surgery, it would have been completely different for her. Maybe having a career change, for example. So what I do is, I treat the acute injury by reducing the inflammation, reducing the pain stressors. And then once that acute phase is gone, we start focusing on strengthening protocols. So we'll start by mild exercises that kind of strengthen the joint, strengthen the muscles, that stabilize the joint, and then moving forward to more high-level exercises like free weights or TheraBands, for example. More balance control, more training that way.
Yeah, I really, really enjoyed that because I believe that also but that was the first time that I heard it described like that. I'm going to use that exercise prescription because what you're doing is prescribing a certain methodology in your training to train smart. You're going to do this, this, and this, and that'll get you the result instead of doing things without rhyme or reason. It's nowadays what's happening is science is merging together with combat sports, with health. But in the old times it used to be like that. It wasn't just so apparent. Now it's very apparent because you look on a video with a UFC fighter and you'll see they'll bring in a movement coach. And it'll be very, he'll start with myofascial release. He'll start then with the stretching, then the warm up. Then, like you said, then you start resistance training with bands and maybe weights. There's a very prescribed way to exercise, which I believe is a smart.
Yeah, definitely. Especially with and every exercise or prescription would be different depending on the injury and the injury site. So you're going to have different exercises for ankle issue or knee issue versus a shoulder issue. So it's very specific.
Yeah, not that you would. I also use that word specificity. For example, in our training, when we go to train athletes, there's general strength, conditioning. So let's say, for example, push-up. Push-up is or bench press is a general strength, and there's specific strength to the specific task and the specific muscles or joints that you're using. And I think it's a combination of those both. And also, for example, there's ability and capacity. The capacity training is, for example, endurance. Creating aerobic endurance, cardio endurance, but then you have a specific endurance where you might have to push a sled or run run with resistance.
Mm-hmm.
So I like that term. I believe that's the smart way to do it, and you see that more and more people are doing it that way. Okay, I wanted to go back into talking about how modern day combat athletes, UFC, Bellator, grapplers, kickboxers, are understanding the merger of, for example, your facilities, sports medicine facilities, health facilities, and the gyms and the schools, and putting these modalities together. You did something interesting, which I want to get to. You had a Graston treatment with a gentleman, and he was going over the moves that he trains in judo.
Correct.
Yes, and I liked how you put two modalities together. You put an elastic modality, and at the same time, you were doing a body work modality. Can you explain a little bit more about that?
Yeah, so he at that point, he had been recovered from his injury, but he had lost some mobility in his shoulder. So he wasn't able to reach with behind his back or reach over as well as he should have. So I had him show me what the normal moves that he would do while practicing judo, and we try to mimic that in the office. So I tied different elastic bands coming from different directions to kind of mimic the resistance that he would get from an opponent. And as he was doing the movements, I was working on that shoulder using the Graston instrument to loosen up that fascia, loosen up those muscles. And in the end result, we had recovered more than 90% of the movement that he lost because of his injury.
Excellent. You know, I'm going to try that out at the school. I'm going to grab some elastic bands and try certain stretches while at that same time doing the roller, the foam roller.
Mm-hmm.
But obviously, it'll be going through the moves that are mimicking that specific movement that we'll be using in class. I like the combination of those modalities. You can see that, for example, in high-level athletes like Conor McGregor, for example. Here's an athlete who has skill, he has martial arts background, he has coaches, but who does he bring in? He brings in a movement coach. Now, what was that? He brought in a coach that was going to do different modalities of health and wellness to increase his movement and his motion, because he knew that if his movement and his motion became better, his function would become better, his athleticism would become better, his health would become better. So you're seeing it more and more and more. Now, let me ask you a question. When it comes to movement and to improve movement, and we're very big on that, I would think the structure would be necessary. I think it would be the breathing would be necessary. What are the things necessary? Biomechanics would be necessary. What are the necessaries to have a healthy movement, a natural movement?
Yeah, so you want to have structure and function. So whatever movement you do in your sport, you want to have fluid mobility of those muscles and joints. Okay, so by what I say fluid mobility, if you raise your arm and we see that your scapula, for example, is not moving in conjunction with your shoulder, then there's a problem there. That means you're going to have fascial restrictions in that scapula that's going to prevent the complete movement of that shoulder. And what's going to happen in the end, you're going to get a shoulder injury, rotator cuff tear, and other injuries that could be prevented if we get that fluid glide of the scapula. And you can apply that to the lower extremity, the spine, for example. So you want to have a movement of the joint itself, movement of the muscles that are moving that joint, and in the end result, the body part. So you go from structure to the function that you're trying to accomplish.
What I like to do again is combine different elements, like let's say first elastic bands,
Mm-hmm.
then maybe a medicine ball, and then the weights. In other words, combine different weight bearing and resistance together to make a holistic approach. What's your idea on strengthening?
Definitely. All that you mentioned, and I would throw in there maybe like a BOSU or some kind of wobble board. Put you on a wobble board and throw the medicine ball around, creating that balance training, which will train your brain in addition to your body. So balance training, stability, and then strength. And don't forget flexibility. Flexibility is one of the main points, so it's very much important as strength. So if you're strengthening and you're working out a couple hours a day building muscle, you want to spend an equal amount of time maintaining that flexibility. Yoga, you mentioned yoga is a good example. Just stretching, dynamic stretches, warm up before the exercises, it's very important as well.
Yes, I looked up some video clips of Amanda Nunes. She's the champion. She's supposed to be fighting Felicia Spencer in the UFC. And when I looked it up, she was stretching with elastic bands, which was combining the flexibility and the strength. What you just said, neurogenic and myogenic training together. Also, Felicia Spencer was focusing on stretching with not with a band, but with a belt, And you mentioned the stretching. Uh, stretching is, I think, sometimes underestimated or underappreciated. And as you get older, or you want to have a longevity in your sports career, stretching is something that's very, very, very important. Would you agree?
Definitely, definitely. I think flexibility is very much as important as strength. So you want to have a good joint, so joint stability, followed by strength of the muscles, and then flexibility as well. Because if you could be the strongest person in the world, but if you have no flexibility, you're still gonna injure yourself. So
You mentioned something, and I'm great that I have a doctor here in front of me, because this is something I've been researching, and maybe you can help me when it comes to the flexibility. A lot of the Chinese masters in Chinese martial arts, they talk about ligament and about tendon stretch and strength, about tendons, the flexibility and the strength of tendons. How can you strengthen and stretch a tendon?
right. So what happens is tendons are very important. So tendon connects a muscle to a bone. The ligaments connect the bones to other bones. So if you have joint instability, that means that your ligaments are not doing their job correctly. So the ligaments are either too loose, or maybe you have a joint dysfunction. So the joint's not performing as well as it should. What happens then? You continue with your sport, and your tendons pick up the slack for that ligament. Okay, so instead of your tendon just being a connection to the muscle, now the tendons start acting as a ligament. So they get overstretched, or they get irritated, which creates tendonitis and other sources of pain. What is important is to maintain that flexibility by doing a dynamic stretch. You mentioned stretching with the bands. That's a dynamic stretch, is to create that fluid movement before you exercise, before you do your sport. And then afterwards, more of a cool down stretch, more of a passive stretch, a longer sustained stretch to increase that flexibility in the muscle and in the tendon that goes to that joint, in addition to getting your regular adjustments to the joint itself to keep it healthy and stabilized.
Okay, excellent. Because in our system, in natural motion system, we have a circular dynamic mobility, which first, like you said, we treated dynamically the stretching, the twisting of the joints, the rotation of the joints. And then something I'm going to add now that I was thinking about what you said is towards the end, more the passive and more using more time and using relaxation and passive stretching, or as you could say, as a cool down.
Correct.
Excellent. I really enjoyed this, like I said, because we're in the same field of promoting life, health, success. I really want to thank you for your services you're providing for us. I feel great. I think that I would suggest anybody, a regular citizen, combat athlete, martial artist, to do the supplementation, the vitamin therapy, combined with the modalities of chiropractic medicine, massage, and all the different modalities and services you provide. I would recommend them to anybody that you want a long and healthy career. So thank you so much for joining me today. Is there any closing comments or any advice you would like to give?
Thank you so much for inviting me again. I really enjoyed this podcast, and I just want to advise everybody: you want to go get your spine checked. Make sure you go to a chiropractor, and so you research your doctor before you go there. Make sure it's the right fit for you, and getting proper adjustments regularly to maintain optimal health is very important for your body. If you have a healthy spine, you're going to have a healthy nervous system, which in the end, you're going to have a healthy body.
I'm glad you said that about the spine. In the Chinese martial arts, they call the spine the Tiangen, the heavenly stem. And they said you're as old as your spine.
That's right.
Yeah, that's correct. Again, I want to thank you, Jimenez Chiropractic Sports Med. I want to thank our sponsors, National Health Transport Industry that work our events, all the doctors that work at event, the ISK, the sanctioning that makes sure it's a safe event, and we believe in safety and keeping everybody safe. Dodge Sports, Reach Combat. If you need any more information, please contact us at 305fights.tv. Dr. Jimenez, I'm looking forward to talking to you again. Thank you so much.
Thank you.
Have a wonderful day.
Appreciate it. All right, you too.
Thank
Bye.
you. 305, donde surgen los campeones. 305 Fights, where the champions rise.
305 Miami, the champion league.